When you talk about predictive medicine, I get a sinking feeling, right? So what if they take my blood pressure, my height, the color of my skin, this picture of my iris and my labs, and they decide that I'm going to be having a heart attack in 5 years? What does that do to my life? And what does it do to my life if they're wrong in their prediction? But so that there's a lot of questions to be answered. Second of all, I was reading an article about one of the fathers of artificial intelligence, and he thinks that large language models and what we have now are just a fad and is not going to go anywhere. He thinks that the next tier, which hasn't been touched, is when you can teach computers to learn like children, where they're seeing, they're hearing, and they're touching,
Right.
multisensory, that these
Oh,
large
that's right.
language models are
Already,
just not going to be what people are promising, and that they just cannot be capable of doing what they're promising. The generative AI helps. I use a scribe, half the time is wrong. And then I use open evidence, which I like a lot. But when I try to get it to summarize the newborn history from the hospital, it hallucinates a lot. I had a kid yesterday, new patient, and he was born at 10 pounds, 10 ounces. Mother's gestational diabetic. And it gave me a normal birth weight because it wants to make me happy. So it's going to give me a result it expects me to have. So I have to type in again, no, give me the actual birth weight of the patient and the diagnosis put by the doctor on the discharge summary. And then it did. So it helps me because I don't have to type that out into the chart. It just generates it and I can put it into the medical history and I'm done. It speeds up the process. But as you said, it has no wisdom and it really doesn't know what it's doing. It's just trying to predict what you want and put it onto a written narrative. And that's it.
yeah,
That's
but
it.
you look at these things as tools, just like the good old stethoscope. It's just a tool. If it
Right.
was really smart, Herb, you'd be out of a job.
Yeah, it's never going to happen.
I know it's never
It's
going to happen,
never,
but
it's never
back
going
to
to
open
happen.
evidence that you're talking about. Open evidence is pretty cool,
It's
but for what
awesome.
what you wanted to do with when you get the 50-page newborn discharge summary from Northwell that you're just looking for the hepatitis B date, you got to scan through 50 pages that you can't find. You can drop this PDF into Doximity. Everybody has a Doximity account. Drop it in there. And the most important thing is summarize this document. Give me the birth measurements in pounds and in metric, because it'll just give you metric. Parents want it in pounds. Give me all the pertinent medical diagnoses that you find and how the child progressed and what were the doctor's thoughts. So this is the code that you put into the search bar. Then it'll give you a summarization of the visit. Now, with that visit, I've seen doctors in my office where they say, why do I have to type that? I just can copy it, cut and paste into the note. You are correct. The darting does have hallucinations and does make a mistake. And now it got into their note, and it is a legal document that Dr. Bravo just put into his note. And you can't have that. So
No.
we print it out, I review it, and I do through my medical scribing technology, I recite what I think is important off that paper. And then that goes into my note and I put it into the pertinent pieces of the EHR. That's okay. So again, I use it as a tool, not as an end all, but in the quest to expedite things, to make things faster, to get out of the room faster, copy, cut and paste, copy, cut and paste hallucinations, and somebody's going to have a negative outcome. I I want to be a medical expert on chart reviews for all these AI written notes because I know which is an AI note and I know which is a human note. And I know why the errors happened.
All right. See, George, see how useful all this stuff is for you. You're not retiring anytime
Yeah,
soon.
no,
Yeah.
I think that yes, they're tools.
Good tool.
They mitigate some of the disaster that the EHRs are, which is they're an accounting tool to help the hospital make more money.
Yes.
They're not a quality, not they're not meant to improve quality of care, and they're not meant to improve the patient experience or the physician's ability to care for their patients. They weren't designed to do that. So it mitigates some of that, but we're far from being able to seamlessly use it. Like what you just described is very inefficient.